Hey, this is Susie, and my gastric bypass surgery is tomorrow. I've been working toward this for, I think it's been a year. Oh my gosh, I think it has been a year. I'll have to check it out, check the dates. But yeah, because I finally got my requirements met and saw the doctor last December, and I had originally had it scheduled in April, but then because of COVID, it's rescheduled. And that's kind of messing with my logical brain a little bit because the COVID pandemic is a lot worse in Utah now than it was back in April. So that doesn't make a lot of sense to me. However, I really need this surgery, and I trust that the doctor and the hospital are being careful and doing everything that they need to do. So I'm going forward. Woo! So I want to apologize for not creating a video last week. I'm gonna sit back and relax. I don't know why I'm all leaning forward. But let me tell you about what's been going on. So last week on Wednesday, let me put my phone in airplane mode so that we don't get interrupted. Last week on Wednesday, I went for my final class. So this surgery is such a big deal that they make you take classes for it. And so there were 3 classes. I had the information session before I made a real commitment. And then I had another class before I saw the surgeon to teach me more about it. And that was back in December. So between December and July, I felt like I forgot everything. And then I had the 3rd class, which you have just before surgery. And I was really grateful for that because I had forgotten everything in 7 months. But it was also terrifying because it's like for a couple hours, you're learning all about everything that could go wrong. You have to read through all these papers and sign waivers that, this is a major surgery. This is a huge commitment. My life is going to totally change tomorrow. And there are a lot of things that I'm giving up. And there were some things I didn't realize I was giving up. So I have sarcoidosis, which is an inflammatory disease. And I can never again take anti-inflammatory drugs because they're too hard on the stomach. And that's a little terrifying. However, my diabetes has gotten worse than my sarcoidosis. So at this point, diabetes would probably kill me faster than sarcoidosis. And I want to live to be 120. So that's why I'm doing this. And yeah, another thing, I have to give up caffeine. Some places I read says it suggests giving it up forever, but at least the first 4 to 6 months. And I didn't know that. I thought I was going to keep drinking coffee and tea. I knew I had to give up Coke because you can't have any carbonation. Air in your belly stretches it. And it also creates a fullness, and there's not enough room for that. And so, no carbonated beverages, no straws, and no chewing gum, because those things all put air in your belly. And from now on, so for the first 3 or 4 months, I have to check again, my meals are going to be 1/4 cup, 2 ounces, or 4 tablespoons. It's not very much. It's like this much. Have you ever seen a 1/4 cup measure? Should have brought one with me. Yeah, 1/4 cup of food 3 times a day. And then if you are really hungry and need a snack, you get 1 ounce of protein 1 or 2 times a day. Then after 6 months, I get to graduate to 1/2 cup of food 3 times a day. And then after a year, I get to graduate to 1 cup of food 3 times a day. And then that's it for the rest of my life. I'll be eating 1 cup of food 3 times a day. I'm an eater, which is why I'm overweight, right? I love food. I love food so much. I love sitting down with a bag of corn chips and a jar of Tostitos salsa and just going to town. or just put some refried beans and cheese and salsa and avocado and eating that with my tortilla chips. I will never be able to do that again. And then when you get to maintenance, where you have lost all of your weight and you're just trying to maintain, you still have a cup of food 3 times a day, but a quarter of that can be healthy carbohydrates. So up until that point, not really any carbs to speak of. You have some incidental carbs in vegetables and in dairy products, but no deliberate carbs. So no rice or pasta or anything like that. And so I was talking to my mom about it, and she was like, oh, so that's keto. And I said, well, the big difference between this and keto is the fat. So keto is high fat. So this diet is low fat, low sugar, which is why the surgery really helps, because without the surgery, it's really hard to do that, especially as a diabetic, because diabetes makes you have more cravings. And this way, the surgery doesn't fix everything. It's a tool to help. But yeah, my whole life is going to change. It's kind of like I'm getting a whole new lifestyle with a whole bunch of rules. And I do not like rules, but these rules are to save my life. So I'm going to embrace them. This is my new religion, is my new lifestyle after bariatric surgery. I'm having the gastric bypass, and we're going to dispose of the excess stomach because of the gastroparesis. It can cause you to still have pain and bloating in that part of your stomach that you're no longer using. So I didn't realize it was a big deal to remove that part of your stomach and just toss it in the trash. Apparently there are a lot of blood vessels attached to it, which totally makes sense. And so the doctor said that's going to add a half an hour to my surgery. I saw the doctor on Thursday, since I hadn't seen him since December. And we talked about my concerns. My anxiety has been through the roof, because even though I've opted into this, I am totally going forward. I have totally embraced this decision. It's terrifying because this is major surgery and it's a major lifestyle change. And even though I know it's the right thing to do, change is hard. And so, yeah, so I've had lots of anxiety. I've had to deal with diarrhea. I've had a migraine the past 2 days. I finally got a release just before I started this video. I was very happy about that. I've been having to take my anxiety medicine more often. So yeah, among the lifestyle changes, okay, so I can't take the anti-inflammatories, and I can't have the caffeine. I get lots and lots of headaches. And so I have to make a new regime to deal with my pain. Because my go-to before was Excedrin and Coke. I can't have either of those things anymore. Excedrin has aspirin in it, which is an anti-inflammatory, and then Coke has the carbonation in it. Plus it has all that sugar. So yeah, that's a pretty big deal. Excuse me. I still have my cough. Over the past 2 weeks, I did do another course of doxycycline, and it has helped me to feel a lot better. I got tested for COVID again on Sunday. They said they only call you if it's positive, and they didn't tell me that the last 2 times I was tested. And I said, oh, that makes a lot of sense, because nobody's ever called me. So that goes to show you, I have not had COVID. But it is a little scary going out in public with this cough, because people look at you like, you're going to get me sick. And I'm not contagious. I've had this cough for months now. But yeah, so what's left? Tomorrow is surgery. So today I had a bowl of cereal for breakfast. I'm going to have a bowl of soup for lunch. And then at 3 o'clock, I'm drinking the magnesium citrate to prepare me for surgery. And I need to make sure and get all packed and ready to go. The hospital is going to call me between 2 and 4 this afternoon to let me know what time surgery is tomorrow. And I'm kind of excited to get this over with and to recover. And I'm already, hope does amazing things. I'm already fantasizing about having a better life after my surgery. So I'm really, really excited. So I will post as soon as I can. I don't know how I'm going to feel or what my recovery is going to be like. They say it's not really painful. Oh, that's another thing. I can't take hydrocodone, oxycodone, or gabapentin, which those are all pain meds that they use to deal with the surgery. That's the reason I can't take those is because my own drug sensitivities. That has nothing to do with surgery. So they're going to use other medications. I think they said tramadol. Yeah, I can't remember. But yeah, so I hope to make a video tomorrow on the go to let you know what time my surgery is. I'm so worried about my puppy. I wanted to take Vinny to the hospital with me, but they said no with all the COVID restrictions. Even if he's a service animal, they did not want me to bring him. And so my daughter and her husband and my grandchildren, they're going to watch my dogs. And yeah, this is so exciting and so terrifying. All right. Well, let me know if you have any questions or comments. And thank you for watching. Talk to you soon.